Mr. D is 57 years old. He's a construction worker. One day he had a fever of 38 degrees Celsius. Fever is a very normal thing for me. According to folks, he shaved himself at home with keys to the limbs. Boobs, however, 3 days after the skin scratch, the chest area is swollen and red and painful. I still don't have a fever. Over the next 2 days, I began to feel increasingly swelling and less urine. I was forced to go to the hospital. It's getting harder and harder to breathe. The swelling in the front of the chest is very painful. He had a CT scan and found an abscess. 85 by 33 millimeters chest wall must have landed to the mediastinum. Your condition is getting worse. Immediately, the doctors have to consult the whole hospital to operate and pleural abscess drainage. And then you're on ventilator and you're in intensive care. So what's an abscess? An abscess that forms when the skin is torn. Void is invaded by bacteria. There are about 10 bacteria on every human cell. And they're all over the surface of the body. So a tear in the skin, it's an invitation to bacteria. When this happens, the immune system responds. A battle occurs, and as a result, the formation of mixture of bacteria and dead cells. To meet tissue, release of cytokines, and call on white blood cells to help. The first white blood cells that arrive will kill the bacteria. Dealing with dead cells. When immune cells lose, it also dies and becomes part of the pustules. Around the pustules will form fibrinogen and surround the blood clots, and gradually fibrosis into a membrane. Sometimes fibrinogen. They're still in the cleavage. Smaller pustules in larger pustules. Even though the pus contains dead bodies, it still has a lot of bacteria living in infectious. If land goes somewhere else, it's even infected with blood bacteria. Abscess causes painful red-hot inflammation. With abscess on skin, at some point, the pus will burst and leak out. But in Mr. C encountered deep abscess drive. Treatment usually with antibiotics. You need to be exposed to the bacteria to have an effect, because inside, the abscess has no antibiotics can only get in by diffusion. This will not be highly effective for large abscesses. That's why Sao is the best treatment with abscess to drain the pus. C was operated on. And most importantly, the surgery for all partitions to be removed. Make sure there is no backlog. In the case of D, easily recognized, he shaved the wine with his keys and scratched his skin. So that's what allowed the bacteria to get in. Is a small scratch too heavy? We've never scratched our skin. Actually, Mr. D has a history of hypertension. Quit smoking for a year. Diabetes mellitus 15. Now self-correcting injectable insulin treatment 10 light units and 10 dark units. Alcohol abuse about 100 milliliters and had acute pancreatitis 2 years ago from alcohol. Diabetes mellitus is a severe chronic disease. It makes it difficult for people with the disease often to paralyze their foot infection. Diabetes mellitus. It's a combination of nerve damage, bacterial infections, abscess cause symptoms of red pain and abscess on the skin. At some point, the pus will burst and leak out. However, your abscess D is not simple. Land abscess deep and ruptures into the pleura, infecting all the important organs in the body, like the heart and lungs. Maybe Mr. D has a blood infection. As said, the abscess treatment page principle is to release. Pus. So Mr. D needs immediate surgery. Drain the thoracic abscess into the right pleura. This is a big pus and it's mandatory for Mr. D. The test return showed white blood cells were 19. Neutral acid is 8%. British D fever CRP 23. Confirm a bacterial infection in the body. The situation is getting worse. D is no longer awake. Consciousness disorder difficulty. Blood pressure drops by 90/60 months. Even if the doctors have rehydration, it shows you're in septic shock. He was placed on an endotracheal ventilator and immediately avoid a coma. Protect your airways as well as support your breathing. Shock is a circulatory disorder. Reduces blood levels in tissues. Septic shock. That is, there's a pathogen in the blood that causes shock. This bacterium secretes endotoxins. These substances have damaged the cytokine-releasing vessels, histamine, and blood coagulants. These inflammatory substances heal the dilated vessels out of the veins. It's like gas in a punctured tire, leading to anemia and hypoxia. Hypoxic cells throughout the body will lead to multiple organ failure. Kidney failure causes decreased urine volume and swelling. The kidney has two functions, urinary and endocrine secretion. Let's imagine the kidney as a big blood passing and kidney. It helps the body retain what it needs to get rid of poisonous things, unnecessary excess product. Normal blood flow to the kidneys is about 1,000 milliliters, to 25% of the cardiac output per minute. When the amount of water in the body blood flow to the kidneys are ordered to reduce urine secretion. Now the urine is less and more concentrated. If blood flow to the kidneys drops urine secretion that can stop is called anuria. The kidneys also need oxygen to be nourished. When blood flow to the kidneys drops below 20%, the kidney cells are starved of oxygen. If the amount is reduced, and prolonged will cause cell damage or death. This condition is not progress to acute renal failure. More dangerous when blood pressure is low, are starved of oxygen and lead to multiple organ failure. Test shows you're 8.3. Creatinine 138 indicates that Mr. D is beginning to have kidney failure. Doctors are constantly monitoring the amount of important tip for shock therapy. Bacteria are replenishing blood flow as well as antibiotics as soon as possible. He was given 3 antibiotics at the same time because of severe bacterial infection and metronidazole. Thanks to proper and timely treatment, his health quickly recovered. The days after that, 2 days later, he's tracheotomy. However, the ducts are still leaking, and you still need antibiotics for a long time. 14 days after the infection was over, the tests ran out of reactions in the body have decreased. After drainage, there is no deported and discharged. Scratching is a small problem. However, it scratches the skin and causes an abscess like it's not that simple. Be careful. Don't take your health lightly. And check early. If there are signs of severe infection like Mr. D, you don't know how much did D cost and how life-threatening it is. Not with a scratch from a key scrape. Thank you. Thank you for your attention. Always stay healthy, and I hope you're all well.